Right now, we are smack in the middle of a staggering pharmaceutical paradigm shift when it comes to metabolic health. But today, we're actually going way past the baseline of simple weight loss. In this explainer, we're going to look at the cutting-edge peptide stacking protocols that are being used right now to selectively burn fat while holding on to your lean tissue. It's fascinating stuff. So, here's our roadmap for today. We'll start with the weight loss revolution, tackle the muscle loss problem, and cover the 2026 FDA reclassification. Then we'll dive right into understanding AOD-9604, break down the fat loss stack, and wrap up with risks and best practices. Section 1, the weight loss revolution and the evolution of GLP-1 efficacy. You know, the sheer magnitude of data coming out of these recent clinical trials is fundamentally changing metabolic medicine. Take a recent head-to-head trial published in the New England Journal of Medicine, for example. Tirzepatide significantly outperformed semaglutide in adults with obesity. Just consider the stark difference in the numbers. Over a 72-week period, patients on tirzepatide hit an average body weight reduction of 20.2% compared to 13.7% for semaglutide. Plus, tirzepatide drove a massive 18.4 centimeter reduction in waist circumference. I mean, we're talking about highly effective, sustained weight loss that was literally unheard of outside of bariatric surgery just a decade ago. But wait, because Eli Lilly's new triple agonist, retatrutide, has completely shattered those benchmarks. It delivered an astonishing 28.7% average weight loss at 68 weeks in the Phase 3 TRIUMPH-4 trial. Retatrutide is a single molecule that activates 3 different receptors, GIP, GLP-1, and glucagon, and the results are just profound. Over a quarter of total body weight lost, alongside massive improvements in knee osteoarthritis pain for the trial participants. It's a real game changer. Section 2. The muscle loss problem. The hidden cost of rapid weight loss. But there is a hidden cost to this kind of rapid weight loss. As Dr. Craig Conover highlighted when talking about this clinical reality, conventional dosages of these drugs often cause people to drop weight way too fast. And the problem is, they're burning precious lean muscle mass right alongside the fat. He noted that patients can get that dreaded skeleton look in their face. You've probably heard the media call it Ozempic face, because the fat and structural tissue just melt away indiscriminately. When you drop a quarter of your body weight that rapidly, if you aren't careful, a really significant chunk of that is going to be your functional muscle mass. So what's the clinically observed solution? Well, it's microdosing GLP-1s via compounding pharmacies, basically slowing the weight loss down to protect that muscle. By dialing in the dosage to specifically target 2 pounds or less of weight loss per week, physicians are finding that patients can still reap the metabolic benefits, but they retain their strength and lean tissue. It completely shifts the whole protocol from a blunt shotgun approach to a highly dialed-in, nuanced therapy. Section 3, the 2026 FDA Reclassification. 14 peptides return to Category 1. This brings us to a massive regulatory shift announced for early 2026. According to analysis from FitScience, 14 key peptides, including the famous tissue healer BPC-157, the mitochondrial optimizer MOTSC, and AOD-9604, were moved from the restricted Category 2 list back over to Category 1. This is a huge victory for metabolic medicine, honestly, because it allows for the legal compounding of these specific amino acid chains once again. Now, the absolutely crucial point here is that Category 1 does not mean you can just run to the store and buy this over the counter. These are still off-label therapeutics. Category 1 simply means legal access through regulated compounding pharmacies with a physician's prescription. So while the whole gray market research chemical vendor scene is likely going to shrink, patients can now actually obtain verified pharmaceutical-grade purity with strict physician oversight, which means avoiding the dangerous endotoxins you sometimes find in those unregulated batches. Section 4. Understanding AOD-9604, Targeted Fat Metabolism. With this reclassification, AOD-9604 has really become the star of the show for those trying to lean out while preserving muscle. It's absolutely fascinating. It's a peptide that isolates and targets the lipolytic or fat-burning fragment of human growth hormone. And why does that matter so much? Because unlike full human growth hormone therapy, which can spike your blood sugar, cause insulin resistance, and stimulate unwanted growth all over your body, this specific peptide zeroes in almost exclusively on fat metabolism. It's like a laser beam. It triggers the release of fat from obese fat cells and literally prevents the accumulation of new fat, making it incredibly precise for bodybuilders or really anyone in a strict cutting phase. Section 5, the fat loss stack. Maximizing fat loss, preserving muscle. This is where modern endocrinology and fitness optimization really intersect into an actionable synergistic protocol. According to endocrinology protocols reviewed in Fit Science, a highly effective stack uses AOD-9604 right alongside MOTS-C. The protocol generally calls for 300 micrograms of AOD-9604 taken subcutaneously in a fasted state in the morning every single day. You take it fasted because insulin actually blunts those growth hormone pathways, and this is paired with 5 to 10 milligrams of MOTS-C 3 times a week to radically improve mitochondrial function and metabolic output. You'd usually run the whole shebang in an 8 to 12-week cycle. And this brilliantly illustrates the modern clinical approach to weight loss. You aren't just starving yourself and hoping for the best anymore. By microdosing GLP-1s, you smoothly control your appetite without crashing your system. Then, by adding targeted peptides like AOD-9604, you're chemically signaling your body to selectively burn fat for fuel while holding firmly onto your lean muscle tissue. It's essentially a 1-2 punch. Section 6. Risks and best practices. Safety signals and medical oversight. Okay, we absolutely must ground all this excitement in objective reality. Take the new blockbuster retatrutide, for instance. Pushing these metabolic pathways to their absolute limits causes systemic stress. The clinical trials revealed a glaring, dose-dependent safety signal for something called dysesthesia. If you haven't heard of it, it's a painful, abnormal sense of touch, where totally normal physical sensations suddenly feel incredibly uncomfortable or even painful. Just notice the jump in the data. It was less than 1% on the placebo, but up to almost 21% of patients on the high 12 milligram dose experienced this. These are powerful biological levers, right? And they definitely are not without side effects. And this is exactly why medical supervision is totally non-negotiable. Harm reduction guidelines are clear. You must consult a board-certified endocrinologist or physician and get comprehensive baseline blood work before you even think about starting. You have to track your inflammatory markers and IGF-1 levels. Use only legitimate, regulated compounding pharmacies to ensure purity. And whatever you do, do not mix your newly legal Category 1 peptides with restricted Category 2 compounds, because that just introduces huge legal and medical risks. Expert guidance is what ensures you're actually improving your health, not just blindly chasing a number on a scale. So, as we move past these blunt force, single drug therapies, a really critical question emerges. Will individualized, legally compounded peptide stacks become the ultimate standard for sustainable metabolic longevity? I want you to ask yourself what the future of hormone optimization looks like for your own personal health goals. Keep questioning the science, and we'll see you next time.